I'm Dr. Kenneth Mugabe. I'm an obstetrician and gynecologist from Mbale Regional Hospital, but also the team lead for the Elgon local maternity and newborn systems. In this system, we do follow up and advocate for maternal and newborn care for all our 16 districts and one city in the region, such that we reduce maternal and newborn deaths in our region. But specifically, I would like to welcome you to today we had a marathon, and this marathon was to create awareness about pre-eclampsia. The month of May is International Pre-eclampsia Awareness Month. But there were several activities that we did during that month. However, we wanted to do this marathon with our partners, Uganda Manufacturer Association, and all our friends, the partners, the corporate. So we shifted it from May to 15th of June, such that we can carry it out with them and continue to create awareness. We want to reduce maternal deaths due to pre-eclampsia to zero. Now, pre-eclampsia, for those of you who don't know it, it is a condition where pregnant mothers get high blood pressure. And usually this high blood pressure starts when they're about 5 months and above pregnant. So, but in our region, one of the biggest problems we have is to detect it early. Many mothers come to our facilities with this condition, and many die. Over 100 women that die in our region, 17 of them die because of pre-eclampsia. That is a very high number, and we want to reduce it to zero if need be. So we are trying to cause awareness in our communities to tell them how to detect this problem at home, how they feel, but also when they come to the health facilities, they should demand that their blood pressures are taken by the health workers before they leave the health facilities, especially when they are pregnant. We do not want to say that it's only pregnant women that get it, because even after a woman delivers, she can actually get it in the first 10 weeks or so. But we usually follow up these mothers for a whole 1 year in case they had it. So we want you to come on board to support us as your leaders in health to bring down deaths of mothers and newborns in our region. Maybe let me ask our representative from Ministry of Health to also say something.
Okay. Thank you. So my name is Jacqueline Akello. I'm an obstetrician gynecologist. I work with Makerere University as a lecturer in the Department of Obs-Gyn. So I teach medical students, but also I coordinate what we call the pre-eclampsia subcommittee nationally. Like my colleague alluded to earlier, pre-eclampsia is really basically high blood pressure in pregnancy. And this is a serious burden globally, I must say. It is the second leading cause of death globally in women. But for Mbale specifically, for a very long time, it has been number one instead of hemorrhage, which is known as number one in the rest of the country and globally. So I first of all want to appreciate Team Mbale for this fight. This is the second run we are having in Mbale to bring down the numbers of mothers dying due to high blood pressure in pregnancy. We had the first run in 2022, and it was from that run we have seen significant drop in the numbers of mothers who are dying due to preeclampsia or high blood pressure in Mbale. And we encourage and want these efforts to continue to the last mile until the last woman down in the village knows what high blood pressure in pregnancy is. Just to talk about what this is, high blood pressure in pregnancy, usually how do you tell as a lay person that maybe I have this? Most times the symptoms are very clear. You feel headache whereby even if you take paracetamol or any other painkiller, it's usually not relieved. So you have that headache that is pounding that even the painkillers cannot relieve you. You feel pain around the upper part of the abdomen, what we call the epigastric pain, most times confused as ulcers. Most pregnant women, and I will repeat this, please do not accept to be treated for ulcers if you're pregnant and you have epigastric pain until your pressure is checked by a qualified health worker. And then you can have disturbing vision. You may be seeing two people instead of one. You see flickering lights. You have smoky vision. And by the time you reach that, actually, they are extreme. You're in the extreme, what you call the danger signs. But there are earlier signs that can be detected in pregnancy. Like if you start having swelling of the body, especially the legs, you gain weight excessively. You know you're supposed to gain weight in pregnancy, but now if you start gaining more than 1 kilogram in a month, 1.5, those are already signs telling you that you're going into dangers of what? High blood pressure in pregnancy. There's a certain amount of weight you should gain per trimester or per week. And also other signs that can be got on the lab, the baby is not growing well. If they do a scan, it is small for the age. They check your blood, you have less clotting factors, what we call the platelets, and so many other things. But majorly for you as a layperson, when you have headache, you have that gastric pain, you're having vision disturbances, you even when the woman just appears confused, and most times this is what the health workers refer to, that the patient is uncooperative, or the attendants, the mother-in-law is saying you're uncooperative, you're confused. It's actually the disease in its severe form. What we want people to know that this is curable if the mother is brought early to the hospital. We appreciate our traditional healers. We appreciate the pastors, but these exacerbate, they make the condition worsen. If you have high blood pressure and you're taken for prayers and you start convulsing, which is now what we call eclampsia, the extreme form of pre-eclampsia is eclampsia, when the woman is convulsing. Most times the community attributes it to witchcraft. But the more time you waste going to church or going to the witch doctor, the condition is worsening. So we would prefer if the mother is brought to hospital and the priest comes and prays from the hospital, as we also do our part. So our call to the community is any pregnant mother with any symptoms, first rush them to the hospital or to the health center, and you can let the other complementary health providers come to the facility and offer their prayers from the hospital so that these lives are saved. We really want this message to reach to the last person down there. We have brochures, we developed brochures are talking points. How do you know the signs? We shared them earlier on in 2022, but we would have, and today we shared some in the streets. Would want people, and Mbale is open for consultation at any one point, but we want to bring down these deaths as we work towards the Sustainable Development Goals by 2030. As a country, we know we can achieve that target of less than 70 per 100,000 live births, and as a subcommittee, we are determined to have less than 8% of the maternal deaths due to preeclampsia. Currently, we are at 16%. So in the next 4 or 5 years, we should be less than 8%. And this fight is not really for health workers. We can't do it alone. We want everyone to be involved in creating this awareness, in bringing the mothers to the facility. We are at the tail end because we receive when the damage is already done. But if they are identified early from the community and brought to us early, then we can achieve the target collectively as a community. So we want to appreciate Uganda Manufacturers Association for partnering with us this time around to spread this message of preeclampsia or high blood pressure in pregnancy. Thank you very much. So thank you for that question. Like I made mention, the leading cause of maternal death in the country is bleeding after birth, what we call postpartum hemorrhage, is globally and even within Uganda. And then the second, which is at about 34% of maternal deaths. Then the second leading cause is preeclampsia, what we are calling the high blood pressure pregnancy, which as of last year's maternal perinatal death report is at 16%. However, for Mbale, the number one cause of maternal death is still preeclampsia, not the bleeding. So that's why this fight is always heightened in Mbale. And you asked why Mbale is having preeclampsia. I will not really say because of a particular region, but we think what data is showing is that, how do you call it, mountainous areas, places with heavy rains, have higher tendencies of having this condition. So probably it is what it is attributable to, but I can't for sure confirm that. But what we know is Mbale has the number one cause of death as hypertension in pregnancy, unlike other regions of the country. And then there are also what we call the risk factors. Who is more at risk? Who is more likely to get this condition. One, people who already have high blood pressure. Even before they were pregnant, they already had high blood pressure. Number two, Mbale has very high prevalence of sickle cell disease. And sickle cell disease puts you also at risk of this high blood pressure. Actually, the prevalence, the patients with sickle cell disease also, Mbale, is above the national average. At the national level, we are at about 13%. Mbale is about 20% of the population. So they are again at risk of having high blood pressure because they have many patients with sickle cell disease. Then there are other conditions like women who have changed partners in a short period. I know you've had, and I really, community, I don't want to take this personal, but it happens that if you've had a recent change in partner, you're at a high risk of getting this condition for many reasons. And also people who have kidney disease, chronic kidney disease, people who have diabetes, have these extreme ages. Nowadays, people are studying and getting pregnant when they're older, 35. You're carrying your first pregnancy at 35, so already your blood system is going down the trend. You're also at risk, and so many others. But when you're pregnant, if you can only come to the facility early, what we call first trimester, the first 3 months, if you can come for antenatal care, there are drugs that are proven to reduce the risk of you getting this high blood pressure. And this is aspirin. It is in our guidelines. We give you low dose aspirin and we monitor you throughout the pregnancy, as well as calcium, but must be prescribed at a certain time of pregnancy before that disease has already happened. Because once it has happened, then we cannot reduce the risk. So that's why we encourage early antenatal care, starting antenatal as soon as you realize you're pregnant, so that we detect your risks and try to control complications.